Conventional and alternative, traditional and non-traditional, science or quackery. These terms are often bandied about in discussions of healing practices not endorsed by institutions of medical authority. But a 1990 study reported in the New England Journal of Medicine estimates that nearly 1/4 of all Americans has, at some time, used alternative therapies to treat a medical condition. Now, traditional medicine is starting to take notice. Missoula, Montana's Institute of Medicine and Humanities explored the connections and conflicts between conventional and alternative medicine in a conference of information and dialogue. This public conference brought together conventional medical practitioners, medical historians, and alternative practitioners in naturopathy, biofeedback, chiropractic, acupuncture, and massage therapy, as well as patients who have made use of a combination of these therapies.
It's time to take off the armor, stop being defensive, and share information and treatments for the benefit of our patients.
Here is that discussion.
We're really impressed with the response that we've had here today. We postulated as we were in the planning process that this might be a subject that was of contemporary interest and that we might have a strong response, and that is what we do see, and so we thank you for that. I'd also like to indicate that in the planning process of this, and all of the people that you will subsequently here today have been involved in the planning process, except for Dr. Savitt, who is a speaker from outside of the city, have also been intensely excited about the development of this conference. And the reason for that, I suspect, is somewhat obvious, and that is that this represents a rather unusual gathering of a portion of our community, which is represented by a great many healthcare givers and providers of care, both within the so-called traditional and non-traditional molds, as well as patients. And I think it's important to keep in mind when we're talking about patients that ultimately all of us are patients at one time or another, and so this is a matrix that we share as both patients and caregivers, and then other people. And we've come here together as a portion of the community to examine and talk about the various forms of health care that are available to us here, and to talk about what the differences in the different types of care are, and specifically to examine, if we can, why patients who are ill choose to have one form of care versus another. So I think that the conference will be interesting and informative. It is set up so that it's a conference of dialogue and exchange of information, and we thank you for coming. As we all know, there's a major restructuring of the entire healthcare delivery system with the present administration. And I suspect with this, in short years, we will have a substantial modification of both the business aspect of healthcare and the human side. That is, that complex and delicate interface of intensely human interaction which occurs both with the patient and his or her caregiver. I would judge that our feelings about doctors and other caregivers will be substantially modified in this process, and am concerned that there will be strong negatives as well as positives as the various programs unfold. The Institute of Medicine and Humanities, who is sponsoring this conference, has emerged over the past 5 years as a cooperative venture between St. Patrick Hospital and the University of Montana, and has as its primary purpose, through the use of history, fiction, philosophy, and the arts to explore the humanistic aspects of healthcare. Within this context, nothing could be more fundamental than a rather comprehensive evaluation as to why patients who are ill and compromised choose one form of health care versus another. Thus, exploring these differences clearly fits within the function of the Institute, which is proud to support this conference. Today's program will be divided into 4 sessions, the first of which is a general orientation and introduction and includes remarks that I will subsequently make, followed by a historical perspective of alternative medicine in America, and then comments by a physician who incorporates both conventional and unconventional therapy in her clinic. We then will have a short break, followed by the second portion of the program, which will include presentation by providers of 5 commonly used alternative therapy. They will tell us of the uniqueness of their therapy and explain to us their views as to why patients choose various types of alternative medicine. We then will have lunch. In the third portion of the program, we'll have interviews with 4 separate patients who've had, as part of their care, both conventional and non-conventional interventions. The last part of the program will include a question and answer period, which will be moderated by Martin Burke. And now, first some observations from the oncologist. That's me. I am an oncologist. I must admit, for the majority of my professional life, I have been something of a standard physician and have not paid significant attention to alternative in medicine, and in fact, am reasonably ignorant about the details of their practice. In the midst of what I would term my transitional period, which was as long ago as January of this year, I appreciated an article in the very prestigious New England Journal of Medicine entitled Unconventional Medicine in the United States. This study was conducted by Dr. Eisenberg et al. From Boston and represents the very first comprehensive effort to accurately measure the frequency and use plus total cost of unconventional medical therapy that occurs within the adult population of the United States. The results of this study have been an enormous surprise, I think, both to people who practice standard medicine and also to those who practice unconventional medicine. And I would like to summarize for you the features of this article in some detail, because most everything that is included within the article is of some interest and certainly germane to the rest of what we will discuss here. The data for the survey was collected in 1990 and is represented by comprehensive telephone interviews that were conducted with 1,539 adults, 18 years and older. Respondents were asked to report any serious or bothersome medical illness they had experienced in the previous year and to provide details of their therapy by both conventional and non-conventional medical services. The definition in this study of alternative medicine is a medical service which is not taught widely in U.S. medical schools. It's important to keep that definition in mind. The survey demonstrated that 1 in 3 respondents reported using at least one unconventional medical therapy in the past year. Those who relied on unconventional medicine returned to their practitioner an average of 19 times for that year period, with an average cost of $27.60, and this is in 1990. The study defined 16 large categories of so-called primary medical conditions, and for these conditions, only 4% of respondents saw a provider of unconventional medicine only without also seeing a doctor. And no respondent saw a provider of unconventional medicine without seeing a doctor for management of cancer, diabetes, lung problems, skin problems, hypertension, GU problems, or dental problems, indicating that in general, people shared the use of both conventional and unconventional medicine for a given complaint. The unconventional medical pattern of use without conventional medicine was more common for 5 of the more frequently cited primary medical conditions, which include back problems, insomnia, headache, anxiety, and depression. 72% of the respondents who used unconventional medicine did not inform their physician that they had done so, indicating that approximately 3/4 of the patients receiving unconventional care simply chose not to communicate this with their physicians. 89% of those who saw a provider of unconventional medicine did so without the recommendation of their physician, indicating that physicians rarely recommend care with unconventional therapy. The frequency of use of unconventional medicine was highest for problems of back pain, followed by anxiety, headache, chronic pain, and cancer. The specific forms of unconventional medicine most commonly applied were relaxation techniques, chiropractic medicine, and massage. There was no significant use of unconventional medicine according to sex or insurance status. The study showed that unconventional medicine is more commonly used amongst persons having a college education than those who do not. It was more commonly used with people having an income of greater than $35,000 per year than those with lesser income. And there was a tendency for more use of unconventional medicine in the western part of the United States compared to the rest of the country. In taking the figures derived from the study, which was exceedingly thorough with regard to statistical guidelines and appropriate sampling, extrapolation to the U.S. population suggests that in 1990, Americans made an estimated 425 million visits to providers of unconventional medicine, which exceeds the number of visits to all U.S. primary care physicians. U.S. primary care physicians would include internists, pediatricians, all internal medicine subspecialties, and family medicine. The number of visits to those people is 388 million compared to the 425 to unconventional providers. 61 million Americans are thought to have used unconventional medicine in 1990, and 22 million saw providers of unconventional medicine for primary medical condition. The expenditure associated with the use of unconventional medicine amounted to $13.7 billion, 3/4 of which was paid out of pocket from the patient. This figure is comparable to $12.8 billion spent out of pocket annually for all hospitalizations in the United States, and is nearly 1/2 the amount spent out of pocket for visits to other physician services, which is $23 billion for 1990. There's other significant data associated with these articles, but this is the salient feature that I wish to communicate with you today. I would mention that the study did not ask questions about the efficacy of unconventional medicine or the quality of patient participation with providers of unconventional medicine. This is being studied and will be reported in a later paper. I think the study does show rather conclusively that unconventional medicine does have an enormous presence in the United States healthcare system. In summary, to review all of this, 1 in 3 persons in the U.S. adult population have used unconventional medicine in 1990. The estimated number of visits made that year to providers of unconventional medicine were greater than the number of visits to all primary care physicians nationwide. The amount spent out of pocket for unconventional medicine was compatible to the amount spent out of pocket by Americans for all hospitalizations. 1 in 4 Americans who saw a physician for a serious health problem may be using unconventional medicine in addition to conventional medicine, and 7 of 10 such encounters take place without the patients telling their physicians. The use of unconventional medicine is distributed widely across all social demographic groups and is generally used as an adjunct to conventional medicine rather than a replacement for conventional medicine. I believe that there is a general feeling amongst the capitals of standard medicine that there needs to be an infusion of some of the philosophy and practice techniques found in unconventional medicine. Perhaps a better nomenclature might be the term complementary medicine, representing a combination of alternative medicine and standard medical practice viewing the patient as a total entity. A very significant event occurred just last year with the establishment of an Office of Alternative Medicine within the National Institutes of Health. This is directed by Dr. Joe Jacobs, a Native American and pediatrician. This office was established under pressure from a congressional subcommittee that finances the Institute, suggesting that new approaches are needed to treat chronic degenerative diseases such as cancer, AIDS, arthritis, autoimmune disorders, and other illnesses which in certain situations are not associated with appropriate remedies with present standard medical therapy. Many mainstream researchers see potential in this new division of alternative medicine as a means of strengthening recent trends towards a more humane style of medical practice. They feel that practitioners of unconventional medicine stress participation of the patient in their own healing and the power of simple things like touch and kindness in the healing process. The primary interest initially in this office is in the use of homeopathy, herbal medicine, and mind-body control techniques. All of this is an impressive start, but it's important to note that the first year's allotment for the study of unconventional medicine is $2 million, a tiny fraction of the overall NIH budget of $13.3 billion for the fiscal year 1993. It is estimated that the $2 million will cover an initial 10 projects. That was the first year, and now they're getting on to the second year where there are more projects. The kind of studies that are anticipated could be like some which in the past have been scorned by the mainstream medical community, but have recently proven to be effective through the use of vigorous scientific methodology. An example of such a study is one recently released from Stanford University, which demonstrated that women with advanced breast cancer have been shown to live considerably longer when they have group psychology as part of their management, compared to those women who receive only standard medical therapy. This specific study showed that women lived twice as long with group therapy and demonstrated that emotions and stress affect illness and that these issues need to be addressed in the therapeutic process. Another example of previously designated unconventional therapy recently received major credibility in the medical community has been the work of Dr. Dean Ornish, who is the director of Preventative Medicine Research Institute in Sausalito, California. His program is entitled Reverse Program, and it concerns non-pharmacologic treatment for heart disease. Just this year, the nation's largest provider of health insurance, Mutual of Omaha, has decided, because of the quality and results of his work, to provide reimbursement for patients participating in a program designed by Dr. Ornish that combines diet, meditation, exercise, and support groups to reverse heart disease. With the exception of chiropractic care, this is the first alternative medicine technique not taught in traditional medical school curriculum to gain approval by a major insurance carrier. And some insurance executives feel that there will be more of these to come about. Also, because of the success of Dr. Ornish's reverse program, cardiologists in several prestigious cardiac programs are offering his program as part of their cardiac therapy. Dr. Ornish's work over several years has shown that the program not only retards but can actually reverse coronary artery disease in certain select patients. He uses his program as an adjunct to traditional therapy and not a replacement for traditional therapy. It is important to note that his good results have come out of many years of rigorous, well-designed clinical research trials, and because of their success, this program is considered to have moved from the alternative medicine fringe into the mainstream of American medical practice. It's of interest that Americans spent $18 billion last year on coronary bypass surgery. This is the #1 health care bill in the nation. In contrast, Dr. Ornish's plan costs per patient approximately $3,500 per year, which is about 1/10 of the price of conventional therapy for coronary artery disease. Could it be that endorsement of this program by insurance companies is related to cost as well as success? One can only wonder. How do we all feel about insurance companies? My closing comment. I think it is important for those of us who practice standard medicine therapy to pay attention to the kind of information that I've just reviewed, and to understand that patients with illness are extremely complex and have enormous needs, which request a very comprehensive and sensitive evaluation of a management program which will provide for them the best of care, and in many cases should be represented by complementary approaches rather than application only of our well-studied scientific guidelines for therapy. The next speaker will be Todd Savitt, who is presently Professor of Medical Humanities at East Carolina University, and next year will be spending one semester in Missoula as visiting Professor of Medical Humanities and Ethics, and will be participating at that time with both the university and with the Institute of Medicine and Humanities. His particular interest is in the history of medicine, and he will speak to us today with a historical perspective of alternative healing in American culture. Dr. Savitt's talk will then be followed by a presentation by Dr. Mary Stranahan. Mary has been in general medical practice in the Mission Valley since 1981, and recently has developed a clinic that is composed of caregivers of both standard practice and alternative medicine, and Mary herself practices both forms of medicine. She then will speak to us about bridging the gulf, combining alternative methods and medical practice in the 1990s. Dr. Savitt.
I guess I should welcome you, but maybe you should welcome me, since I just arrived. I don't mean by that. No, I don't mean that way. No. I just mean that I just arrived last night from North Carolina, where it was in the 80s. And I like coming to a place when it's dark. I do and I don't. The reason I do is because then when I wake up in the morning, it's always a surprise what it's going to look like where I am. I've been to Missoula before, about 5 years ago, but I don't remember it that well. So I got up this morning, and I usually jog each morning, and so I got up, and it was about 6 o'clock, and it was still dark. And I thought, well, I think I remember where I'm going and a little bit about the town. I had looked at a map and had a pretty good idea about which direction to take. I went down Broadway and kept looking around and saw a few familiar things. And then I remembered the university was off to the right, so I went across a bridge and went over to the university, where it's very dark. There are no lights. And it was now getting about 6:45 when it's pretty bright in Greenville, North Carolina. And it was still dark. And about 7:15, I was getting back, and it was still dark. So my question to you is, when does it get light in Missoula? When does the sun rise? And then Jan Willems told me that we're right. I didn't think about this. You're right on the edge of the time zone. So if I just went a few miles west, it would be very early. And it's great to be here, and I'm really looking forward to being here next fall, about a year from now, and getting an idea about what the weather will be like by coming now. Right before the talk, someone came up to me and said, what are you going to talk about historically? Because all the talks that I've heard are historical talks about alternative healing, indicate that alternative healing kind of died a death in the 19th century and doesn't continue today. That's not my job, obviously, because we have a full crowd of people who are interested in alternative healing today, not because I'm here talking about history, but because it's an important part of healing today. So what I'm going to do, my job, I guess you could say, is to provide some historical perspective on the topic, just so that you don't think it's a new phenomenon. I suspect that most of you realize that this is not a new phenomenon. We didn't invent alternative healing in the past few years. I'm not going to cover the alternative healing practices that are going to be discussed during the conference today. I'm going to go back into the 19th century a bit and talk about some other alternative healing practices, one of which has continued today. Well, you'll see. You can judge for yourselves. A couple of thoughts before I launch into the main part of my talk. There's always been alternative healing in America in an interesting way. Every culture that has come to the United States at first saw the healing practices of the other cultures that preceded it in this continent, on this continent, as foreign, as perhaps interesting, and sometimes even attractive enough to think about using. In other words, using it as the alternative to what was for that group the mainstream of medical healing, medical practices. Especially when the mainstream practices didn't cure the particular ailment or ailments that that individual or that group was concerned about. So in the eastern part of the United States, and this was a big transition for me to have to all of a sudden think, well, I'm not just talking to a crowd that knows the East. In fact, here, a lot of the things I'm going to talk about took place way before white settlement took place. So it's a kind of an interesting thing for an Easterner to start thinking about Western history in this way. So in the eastern part of the United States, there were, if you to use shorthand, white, red, and black cultures, the European culture, North American, Native American cultures, and African cultures. And each of those groups had different sorts of healing practices and encountered new healing practices from the other groups that they met and had to adjust, looking at them, at those other practices as perhaps alternatives. And in fact, some were adopted into those into those medical practices of those cultures, for better or for worse. In the western United States, there's some of that same interaction, plus you have cultures from Spain and then from South America and from Asia. And so you get a different kind of mix going through the 18th, 19th, 20th centuries. So there's lots of intermixing in American history of medical cultures that you could say perhaps threatened whatever the establishment was for that particular culture. And therefore thought of the other cultures as alternatives. The conference that we're involved in is taking place because medicine is not, or medical healing, I guess I should say, is not just what we would think of as a science, but it's also based on culture. People decide what's mainstream and what's not mainstream for the group. And so we get what is mainstream to one is and acceptable to one group may not be to another. So what we're talking about is not just the scientific basis of these alternative healing practices, but how do we, and even using the term alternative is a cultural bias, perhaps, and that's something that we might want to talk about. What we're trying to do here is explore the interaction between medicine and culture. Okay, let's go and look at some of the specifics, go back to the 19th century. The one thing that I'd like to caution you about, and I probably don't need to do that to this group, is to try to avoid the term, what historians, I guess, call presentism. Presentism is applying present-day values to the past. And for instance, if I held up, yeah, maybe I will. I'm not. If I said to you, anybody feeling sick? Anybody got a cold or something like that? Okay. If you came to me and I was your healer, and you said, I really feel bad, and I said, well, you came to the right place. Just come on up here, and I'll take a few pints of blood from you, and here's a lancet, and I'll just take a few pints of blood. You would say, no way. Okay, no thank you, that's very nice. But if you were living back in the 1830s and you came to me, you would say, sure, doc, and you would roll up your sleeve or bare your chest or wherever you were expecting to have bloodletting done, and I'll show you a little bit about that, then it would be no problem, right? So what I'm asking you to do for this little while here is to suspend what you know about the present, which for a group of people who are interested in alternative healing, that should not be a big problem because you're dealing with that relativism all the time, comparing mainstream and alternative healing. So with that caveat, Let's go back and look at what medicine was like in the 19th century and how alternative healing surprised the mainstream and caused a kind of a revolution. America in the 19th century was quite rural. Cities were not very big, and there weren't many cities. And people were pretty self-reliant, medically speaking. By necessity, perhaps because it was very difficult to, if you needed a physician, to get to that physician. Domestic medical guides were quite popular. Oh, I guess the light isn't on. There we go. Is that the first one? Yeah. Can everybody see, or do we need to dim a little bit? How's that? Okay. I'm standing right in front of you, I know. Sorry. Domestic medical guides, such as this one, were quite common. People were self-reliant. They didn't have easy access to physicians, so you wanted, if you needed to find out something, you looked it up in your Dr. Spock of the day. And here are a couple of examples of domestic medical books. When the remedies that you tried didn't work, family remedies didn't work, your friends' remedies didn't work, the book didn't help, and you were desperate, you would, if you could, try and call in a physician, which was no mean task, because how do you call a physician? You don't use a telephone. You ride on a horse, write a note, ride on a horse, and find the physician. You may not even be able to find him. You may be out on a house call. At any rate, you called in the physician. What did the physician do? Oh, here's an example. I know you can't read this. I couldn't read it very well either. This is a typical kind of letter. This is 1815. This is Albemarle County, Virginia, around Charlottesville area, written by a plantation owner to a physician in the town of Charlottesville, a guy by the name of Charles Brown, saying, I've done all these things. He describes the things he's done for this sick slave in this case, and I need your help. Can you either tell me what to do or come and help out? So that call for help would then be followed by either advice from the physician in writing or in words communicated through the party that found the physician, or it would be the physician, mostly himself, would go to the place and try and treat. What did the physician do? Well, there were several theories of medicine at the time. This is all leading up to alternative healing. I need to set the scene by telling you what was around in sort of mainstream medicine of the time. Well, the humoral theory was still there, still common, still thought of as appropriate. This humoral theory goes back to the ancient Greeks. I'm not going to give you a history of that. That could go take the whole amount of time. But humors were based on the idea that there were four things in the body, four humors that came from different parts of the body. And if you look at the underline, number 3s in each of them, you'll see what they are. They're yellow and black bile, yellow bile from the liver, black bile from the spleen, blood from the heart, and phlegm from the brain. I know that sounds strange, but it came down from the brain and cooled the heart and lungs through the respiratory tree. Those four humors, when they were in balance, meant that you were healthy. If they got out of balance, then you had a problem. And the easiest example of that is to look at yellow bile and phlegm, which yellow bile you'll see is hot and dry if you triangulate, and predominates in the summertime. Well, how do you take care of that kind of disease? Well, you use a cold remedy. You use something that's wet and cold. It's opposite. So something wet and cold that predominates in the winter. And the same thing is true. I'm sorry, let me just backtrack for one sec. The humor of yellow bile would predominate in the summertime, and you'd get intestinal type diseases, other kinds of diseases that predominate in the summertime, and hence liver. So a bilious disease, a disease of bile. Whereas in the wintertime, you would get a disease of phlegm, a phlegmatic disease. And you'll notice that the word is also a word we use to describe people's humors, right? The way people are, a bilious person, a phlegmatic person. That's true. I mean, that's tied in with the humoral theory. So if you had a disease of phlegm, then you would try to treat it with its opposite, a disease that, a remedy that is hot and dry, a summertime remedy. So that's a brief course in humoral theory. There's lots more to that. But that's one of the ways, one of the theories of the day. Other theories of the 19th century included the idea that most disease was caused by a constriction, over-constriction, or relaxation, I guess would be the word, of blood vessels, muscle tone in the blood vessels. And therefore you have to either remove blood or do something to constrict those blood vessels. Mainly the ideas that predominated were ideas of balance, that you needed to maintain the balance in the body between inside and outside. What you ate had an impact on the balance inside the body. What you drank, how you worked, how much you worked, the environment in which you lived, all of those things contributed to whether you were going to get sick and whether you were treating your body well and could keep it healthy. Well, so the theories about how to take care of those diseases match these theories. And I like to think of the term that's usually used as heroic medicine, and it's more of an orifice approach to disease. Anything you can get out of the body to see what's going on inside the body, you use the orifice approach. Because you couldn't just do an exploratory laparotomy or open up another part of the body and look inside and see what was wrong. Thermometers weren't around to check temperatures. You could feel a person. But lots of things that we take for granted weren't available. So how do you find out what's going on? You see what's going on inside the body. And you see your progress by seeing what's going on, what comes out, like vomit, like enemas. I see a little magic pointer here. There's the potty stool. There's called a clyster or clister, C-L-Y-S-T-E-R. And there's the patient. I'm not sure what she's doing. Or bloodletting, taking blood like I tried to do and wouldn't accept. Bloodletting to get blood out of the body. Or leaching, which is another form of bloodletting, to get things out of the body. This is a very short course in 19th century. I'm going to have to abbreviate that part because I want to get to alternative healing. Suffice it to say that regular medicine was doing these things and doing them quite well, thank you, they thought, in the early 19th century. When all of a sudden, the country was swept by storm by several groups of alternative healers, and it threw the regulars off. And if you want to learn more about these, take my course next fall when I'm here, but Norman Gevitz edited a book called Other Healers, which I think is on your bibliography and has a chapter on some of the healers that I'll be talking about and some that I won't be talking about. So a book worth looking at. The first of the alternative healing groups that I want to talk about briefly is this one. I'm afraid this picture is not a very good one. It's the best that I could get of Samuel Thomson, and it's T-H-O-M-S-O-N, no P in it. He was born in 1769 and died in 1843. I'm not a dates and facts guy. If I were teaching a course, I would say you don't have to memorize when he was born and when he died, but it gives you an idea about the time period we're talking about, 1769 to 1843. Thomson was born in New Hampshire. He, as a kid, was always curious about the outdoors and about farming and about the herbs that grew locally. And he would always try them out, and he used to try them out on his friends. I don't know how he kept them because one of his favorite ones was one that made people vomit, Lobelia inflata. It makes you sweat and all kinds of things. It's an emetic, basically. He, to make his relatively long story short, developed a system of medical healing because he was fed up with the heroic medicines of the regular physicians. He thought that what regular physicians did by using these harsh remedies that made you do the things that I showed you, he said those were terrible and bad and killed patients. The one that he most objected to, and the one that I don't have a picture of, is something called calomel, C-A-L-O-M-E-L, which is a mercury compound that in overdoses, when you give too much, and that was the way you figured out whether you were giving enough, is to give this overdose. It makes your teeth, your jaw, basically the bones, rot so that the teeth will become loose. It's a fairly strong medicine. In smaller doses, it's either an emetic at a very small dose, or in a slightly larger dose is a cathartic. But in very large doses, does this other terrible thing to you. At any rate, Thompson said that this is bad, and he objected to it and developed his own system based on botanic healing. He was a guy who said, don't use metallic remedies, don't use metals like mercury compounds, and there were lots of others. And the other part of his theory was that all disease is caused by a loss of heat, and the only way that is that cold in the body, invading the body for various reasons. Cold is the enemy of health, and so what you need to do is restore that lost heat. How do you restore lost heat? Well, I'll tell you for $20. He developed a system that he patented in 1813, which was based on several things, mostly lobelia and steam baths and cayenne pepper and certain herbal teas and tonics, things that will make you hot and make you feel like you've restored your lost heat, and therefore make you healthy. He would sell these remedies. He wrote a book, which is what's called The New Guide to Health, or Botanic Family Physician. It was a home remedy system. Remember, I showed you that slide of domestic healing books. He bought right into that and played that because most people preferred to do it themselves. So he wrote this New Guide to Health, and just in case you're interested, he tells you about his life too, included in the book. But just this would not give you the ingredients. In order to get the ingredients, you have to pay $20. You buy a right to the system, and then you can go and belong to friendly botanic groups in your local area. And this was very appealing to rural folks who wanted occasions to get together. They would meet on a monthly basis. You could buy your remedies from the agent who would go around to these various groups and sell the remedies. You could exchange recipes, etc. So the Thompsonian movement really took off in rural areas. It took off so much that it threatened the regulars to the point where state legislatures were beginning to abandon or retract licensing laws in the 1830s and 1840s because Thompsonianism, which had as its slogan, "Every man his own physician," was threatening the regular physicians so greatly. So, Samuel Thompson and Thompsonian medicine. Here's, you could buy remedies. This is in I think this one is Baltimore. Second healing practice that was a threat to the regular physicians was homeopathy. Homeopathy was founded by a German physician named Samuel Hahnemann. Hahnemann's years, interestingly, are 1755 to 1843. Remember Samuel Thompson, 1769 to 1843. Just about the same time period. Hahnemann developed his ideas in the 1790s. He was a physician who developed ideas that were different from regular medicine, as I say, in the 1790s. And by the early 1800s, had written a book about it. The New Organon was the name of the book. His theory was based on two original basic principles. Okay, the first, got the right spelling there. I have one slide that I don't remember if I threw away that has it's spelled wrong. Similia similibus curantur, like cures like. What he said was, and this was based on the use of quinine for malaria, that if you give somebody a medicine that recreates the symptoms of a disease, then that medicine will cure that disease. Actually, it's a little more specific than that. If you give somebody a medicine that causes a certain symptom, then it will cure that symptom. Okay? And malaria, he thought, was a perfect example, or quinine was a perfect example of that, because a apparently in small doses, it gives you some of the symptoms of malaria, but it, of course, makes it go away. I'm not sure that it really cures malaria, but at least the symptoms go away. Smallpox vaccination came in right in the 1790s and seemed to confirm his idea. So the idea got really widely disseminated. Some of his disciples came to the United States beginning in the 1820s, and the idea of homeopathy continued and grew. The other major tenet of homeopathy is infinitesimal doses. That is, you take a medicine, a pure drop of a medicine, put it in 99 parts of, and I've read two, either alcohol or some dry powder, shake it up, succussion, break it up, break up molecules. Then do that 29 more times. Take one drop of that dilution, put it in 99 drops of alcohol, shake it up, and then do it. So you do that to the 30th dilution, and that's the most potent medicine you can use. Because when you're sick, your body is very delicate, was the idea. This is gross generalizations, I know. Those of you who are experts on homeopathy, I apologize. I'm just trying to give a kind of a general outline. Well, given the heroic medicines, the orifice approach to disease that the regular physicians were using at the time, this was a very appealing idea. And so homeopathy really took off. The people who adopted it were physicians. Many regular physicians adopted homeopathy and practiced, either went wholeheartedly into homeopathy or used both systems, the regular, which Hahnemann dubbed allopathy, which means opposites. Remember, going back to the ancient Greek humoral theory, you used the opposite treatment. Hahnemann, I'm sorry, the regular physicians would either mix the two, homeopathy and allopathy, or go entirely into homeopathy. Again, a great threat to regular physicians and caused no little consternation. You could buy a home homeopathy kit, even. Homeopathic physician business card. Okay, third alternative healing system. What does this guy do for a living? Just looking at him. What is it? I heard it. Not undertaker. It's not. Minister, yes. Sorry, I know I've offended 10 or 15 people now. Okay, this is Sylvester Graham. Sylvester Graham. His years, 1794 to 1851. Again, a contemporary of the other two. Graham was a temperance lecturer, but he was also a minister in the middle states, I guess you would say, from Connecticut and New York down through Pennsylvania, in that area, Rhode Island. He was, as you can see, a very intense guy who had very strong feelings about things, and especially about the way people ate and took care of themselves. He thought that people ate too much meat. He was an advocate of vegetarianism. He thought that people ate too much finely milled flour. He was an advocate of the whole grain. He felt that people didn't exercise enough. They didn't drink enough water. They remained indoors too much. This was the period, one of the periods when many Americans were moving to towns and cities, the mid 1800s. And he said, look, we've got to change things. We've got to do more than this. And they drank too much. He said, in fact, you shouldn't drink alcohol. He also was very upset with sexual mores of the time. The only time that one should have sex is during, in marriage and only for procreation. Well, he took these messages around don't use stimulants, no coffee, no tobacco, all of these ideas. He took them around with him as he broadened his appeal and developed what came to be known as a health movement called Grahamism, or the followers of the Grahamite movement. The most famous part that we remember him for is Graham flour, which if you buy Pillsbury flour, you'll see in parenthesis, it says whole wheat flour, parenthesis, Graham. Did you all see that? You want me to go back for a sec? See it? You can make Graham cookies. These are early 20th century recipe books. Graham cookies with the great Arm & Hammer soda, baking soda in it. Or Graham bread. Insist on great Arm & Hammer soda. And the Graham cracker, of course, is what I'm getting to. The Graham cracker, which nowadays has lard in it and too much sugar and all kinds of things. Graham would be very unhappy with the way Graham crackers have evolved. I think you can get them without lard now, but for a vegetarian, that would be a terrible thing. One of his followers was William A. Alcott of the famous Alcott family of New England. Graham got many followers and was a part of he developed he became part of a group that, or his movement became part of the reform group of the mid-19th century, people who were interested in not just health reform, but in the common school movement, in the anti-slavery movement, in the bloomer movement, which is to get women to not wear these tight corsets, but to wear loose-fitting clothes like this. Dress reform, women's dress reform, the Women's Dress Reform Physiological Society, etc. It was the left-leaning liberals of the time who adopted the Graham movement. And they had, at Brook Farm, that experimental community up in New England, they had a Graham table where people would eat Graham-type foods. There was a Graham journal, a Graham bookstore. It was quite a strong movement. And the predecessor to the New England Journal of Medicine, the Boston Medical and Surgical Journal, was very upset with Graham and wrote strong editorials against the Grahamite movement because it threatened the regular physicians. Many people were adopting the ideas of the Grahamites. So here's the diet reform. You know, we think we've got the monopoly on diet reform in this century, but it goes back to this time period. One more movement, and then, whoops, there's Amelia Bloomer herself in her displaying her bloomers, which most people think of as something a little different from this. But it's a pantsuit, right? Okay, this is an obscene picture of, this is maybe pornography of the mid-19th century. This is hydropathy or hydropathy, the fourth of the alternative healing movements of the time period. This came from Silesia in Europe and was developed by a guy named Preisnitz. His idea was that you needed water in and around your body, and that would prevent illnesses. It wasn't so much a curative thing, at least not for acute kind of illnesses, but for long-term illnesses where you needed chronic care. You would do, like here's sweating, then take a cold bath after sweating. Here's a douche bath, which is basically a cold shower, a half bath where you just sit in it, and a head and sitting bath. And there were all kinds of varieties of this. You went to places like this, so you had to have a little bit of money. These are water cures. This is different from hot springs. I'm not talking about hot springs here. These are water cures. Physicians staffed them, like Dr. Troll from New York and others. And you do exercises to, in this case, strengthen the uterus, because women, in this one particular, because women's main role was to bear children. At least that was the thinking in the 19th century, and therefore they needed to be good and strong for that. All of these movements were quite popular in the mid-19th century. All of these movements threatened greatly the regular physicians of the time. Here's a spoof to show how popular these movements were in a magazine of the mid-19th century of hydropathy. Just pouring water into this guy. You can see what's happening to him. So it really reached the mainstream. I mean, it touched people and therefore was a great threat. A quick postscript to this in 2 or 3 slides, and then I'll quit. All of these reform movements got tied up together in an interesting way in the late 19th century. This is Ellen White, but she did found a sanitarium in the town she lived in, which is Battle Creek, Michigan. She lived there with a number of other Seventh-day Adventists, which is the religious movement, among whom was the Kellogg family. And young John Harvey Kellogg was sent, because he wanted to become a physician, was sent east to learn hydropathic medicine and to learn other regular medical practices. He then went back and became the chief of the sanitarium and developed there, with his brother Will Kellogg, a health food, because they were vegetarians, remember. The Seventh-day Adventist movement was a carry-on of the Sylvester Graham movement, of the vegetarian movement, and developed cornflakes by developing a processing for flaking the breakfast cereal. At any rate, basically what I'm saying is that what we think of today, in fact are attacking today, as unhealthful food, I don't know that cornflakes is really qualifies, but breakfast foods for sure, actually started off as part of a health movement that goes way back to the early part of the 1800s. So I've packed a lot into a short time to give you some perspective on alternative healing in the 19th century. We're now going to continue our discussions and look at alternative healing in the 20th century and in fact today, and we may see some of the carryovers from the 19th century. And also we may want to speculate over the day about why it's so popular today, alternative healing, and why it might have been popular at the same back then. There may be some of the same reasons. Well, thank you very much.